7 foods to avoid if you have arthritis. Arthritis is a condition characterized by inflammation and stiffness in the joints, which can cause pain and discomfort. While medical treatments and lifestyle changes can help manage arthritis symptoms, diet also plays a crucial role in either alleviating or exacerbating the condition. Certain foods have been shown to promote inflammation in the body, worsening arthritis symptoms. Here are 7 foods to avoid if you have arthritis. 1. Processed foods. Processed foods, such as fast food, packaged snacks, and pre-packaged meals, are often high in unhealthy fats, refined carbohydrates, and additives. These ingredients can contribute to inflammation in the body, worsening arthritis symptoms. Opt for whole, unprocessed foods whenever possible to reduce inflammation and support overall health. 2. Sugary beverages. Sugar-sweetened beverages like soda, fruit juice, and sweetened teas can spike blood sugar levels and contribute to inflammation. Excessive sugar consumption has also been linked to weight gain and obesity, which can exacerbate arthritis symptoms by putting additional stress on the joints. Choose water, herbal tea, or unsweetened beverages instead to stay hydrated without the added sugar. 3. Fried foods. Fried foods, including French fries, fried chicken, and potato chips, are high in unhealthy fats and calories. These fats can promote inflammation in the body and contribute to joint pain and stiffness. Instead of frying foods, opt for healthier cooking methods like baking, grilling, or steaming to reduce inflammation and support joint health. 4. Red meat. Red meat, particularly processed meats like bacon, sausage, and deli meats, contains high levels of saturated fat and inflammatory compounds like advanced glycation end products, AGEs. Consuming red meat regularly has been associated with an increased risk of inflammation and arthritis flare-ups. Instead, choose lean protein sources such as poultry, fish, beans, and lentils to support joint health. 5. Dairy products. Dairy products like milk, cheese, and yogurt may exacerbate arthritis symptoms in some individuals. Dairy contains a protein called casein, which can trigger inflammation in sensitive individuals. Additionally, dairy products are high in saturated fat, which has been linked to inflammation and joint pain. Consider reducing or eliminating dairy from your diet and opting for dairy-free alternatives like almond milk, coconut yogurt, or cashew cheese. 6. Refined carbohydrates. Refined carbohydrates, such as white bread, white rice, and sugary snacks, have been linked to inflammation and may worsen arthritis symptoms. These foods cause rapid spikes in blood sugar levels, leading to increased inflammation and joint pain. Instead, choose whole grains like brown rice, quinoa, and whole wheat bread, which contain fiber and nutrients that support joint health. 7. Alcohol. While moderate alcohol consumption may have some health benefits, excessive alcohol intake can contribute to inflammation and worsen arthritis symptoms. Alcohol can also interact negatively with certain medications used to treat arthritis, leading to potential complications. Limit alcohol consumption to no more than 1 drink per day for women and 2 drinks per day for men, or consider eliminating alcohol altogether to support joint health. These 7 foods and making healthier dietary choices, you can help reduce inflammation, manage arthritis symptoms, and support overall joint health. Incorporate plenty of anti-inflammatory foods like fruits, vegetables, nuts, seeds, and fatty fish into your diet to further promote joint health and well-being. Additionally, consider working with a healthcare professional or registered dietitian to develop a personalized nutrition plan that meets your individual needs and supports your arthritis management goals. With the right dietary choices, you can take control of your arthritis symptoms and improve your quality of life.